Good day. So in this video, we're going to do the different types of consent. So first, we're going to do the express consent, which is, it may be oral or in written. So through both these categories of consent are of equal value. Written consent can be considered as superior because of its evident value. So first, we're going to do the oral consent. It should be taken in the presence of an interested third party, mainly in cases where intimate examination of female is required, thus necessitating removal of body fluids. Radiological examination can be done after securing oral consent. So this is how we do the oral consent in the right way.
Good day, ma'am. Ako po si Bridget, your nurse for today. Gagawin ko lang po ang Leopold's maneuver para po malaman natin yung position ni baby. Sige. Position ko lang po kayo.
Okay.
Okay lang po ba ang ibaba ko ang inyong po?
Oh, sige lang.
So, ma'am, okay naman po ang position ni baby. Nasa normal po. Ang ulo niya po ang nawawala. So, okay po ang inyong ano. Thank you po.
Thank you, nurse.
So now, the next one that we're going to show you is the wrong way of getting the oral consent from the patient. So this is how we do it.
Good day, ma'am.
The next one is the written express consent. So, it is advisable to take written consent in the presence of disinterested third party. So, this third party is only to attest the signature of the patient. Consent should be taken in the patient's own language. Written consent is mandatory in every invasive in diagnostic, therapeutic procedures, or any medical legal examination. So, this is how we do the right written express consent.
Good day, sir. Ako po si Eliza. Ako niyo po nurse ngayon. Sir, remind ko lang po kayo sa inyong surgery mamaya. Ano po? Incision and drainage po. Ano po yung tuhod niyo? Andito po yung nana niyo. So, kailangan po maalis to. Nandito ito. Okay po, sir. Puno na po kasi siya ng nana. Yung pigsa po natin ngayon, aalsin natin through that process. Sir, ganito na lang po. Kailangan po namin ng inyong consent. Kailangan po natin ng written. Kalma na lang po kayo dito sa may pangalan niyo sa ano. Sir, thank you po. Balik na lang po ulit ako. Thank you po. Good day, sir. Ako po sa Liza. Di ko po may surgery kayo mamaya. Ako pero mga po dito. Pare po. Sige po, thank you po.
So, the next consent that we're going to show you is the implied consent. It may be implied by patient's conduct. So, it is basically the conduct of the patient when he comes to the doctor for examination or treatment. Doctor should remember that this is only for routine examination as well as treatment. This does not extend to the performance of intimate examination or diagnostic procedures. If there is slightest chance of any complication, express consent should be taken. So, this is how we do the right implied consent.
Good day, ma'am. Ako po si Paula. Ang nurse niyo po ngayon. Kukunin ko lang po kayo ng vital signs.
So the next thing that we're going to show you is the wrong way of getting the implied consent. The next thing that we're going to show you is the tacit consent. Tacit consent means implied consent understood without being stated. Usually the way a patient presents himself for treatment implied consent. So this is how we do the right way of getting the tacit consent.
Excuse me, nurse. Nasaan po si Dr. Hernandez?
Ma'am, pakihintay na lang po si Doktora. Nagra-rounds lang po.
Okay.
Tatawagin na lang po muna po kayo.
Okay, sure. Excuse me, nurse. Bakit niyo po ako pinatawag?
Ma'am, hindi niyo po ba alam? Follow-up check-up mo po ngayon.
Ah, ganun ba?
Paupo na lang po doon. Tatawagin na lang po
Okay.
kayo mamaya. Sige po.
And now we're going to show you the wrong way of getting the tacit consent.
Excuse me, nurse. Bakit niyo po ako pinatawag?
Ma'am, hindi niyo po ba alam? Follow-up check-up mo po ngayon.
Ah, ganun ba?
Paupo na lang po doon. Tatawagin na lang po
Okay.
kayo mamaya. Sige po.